Thank you so much for that introduction. Good afternoon or good morning, depending where in the country you are. Thanks so much for taking the time to join us today. I'm going to talk to you guys today about how to VETIGEL. Um, as mentioned in my intro, I do have my own little herd. I actually have added a horse since I wrote that introduction. So I have four cats. All of them are foster fails. I myself proclaimed crazy cat lady. They're all pictured there. And then I have a 28-year-old horse named Reggie. And then just got a pony named Mo Money, Mo Problems, which is really truth in advertising if you know anything about horses, for my daughters to start their own horse journey. But when I'm not with my family and I'm not with my own animals, I am the medical director at the Virginia Beach SPCA. So, what the Virginia Beach SPCA is, just so you have a little context of where I'm coming from in my experience, we are a combination animal shelter. We also have a wellness clinic. We have a full service clinic that serves income qualifying clients in the community. We also have a mobile veterinary clinic that goes as far as 6 hours away, providing services to areas that are underserved. And we do a little bit of wildlife work as well. And so I see a large variety of patients, all the way from the newborns in the shelter that are in need of help, the orphaned newborns, all the way up to the geriatric patients, either in homes or that have found their way to our shelter. I do have 7 veterinarians that work at my shelter, and because we have such a comprehensive medical staff, we get a lot of referrals for illness and surgical services from our local emergency clinic. We just did a hair tie exploratory yesterday from one of the ERs. We also get lots of referrals from other rescues and animal shelters in the area, whether they don't have their own vet or they just don't have the capabilities to handle what they're seeing. We get a lot of transfers in and or just referrals for services that way. So because I see a large variety of patients, I have gotten to use VETIGEL in a lot of different ways, which I'll share with you today. So a lot of people, when I start talking to them about this product, they ask me, why is it important? Why is hemostasis important? What we've been using is fine. Um, I know I heard this phrase in vet school, what feels like forever ago. But lots of us have heard that phrase, all bleeding stops eventually. And that's true. It does one way or another, right? Our goal is to stop that as quickly as possible and minimize harm to the patient in the process. And if we kind of look through history, even though we've known for a long time that bleeding is life-threatening, there hasn't been a lot of advancements when it comes to hemostasis. So this product is really a new product. There's not a lot like it out there that works in a slightly different way. So if you bear with me for a minute, we look back at the history. When you look through the literature, hemostatic techniques have been used for thousands of years. As far back as the second century AD, you can find descriptions of using pressure or twisting, ligation, cautery, and hemostatic products. At that time, that was things like powdered risins and clay. In the Middle Ages, they started really focusing on cautery. And at that time, blood was considered unclean. We knew it wasn't great to have blood outside the body, and your surgeons actually had a lower social status compared to physicians who didn't deal with as much bleeding. So they knew it wasn't great to be bleeding, wanted to put a stop to it. Ligatures kind of started appearing more in the 18th century, and then chromic catgut was manufactured in 1870, and still some people still use it today. Um, Along the way, hemostatic products have changed a little bit, but not necessarily a ton. They all tend to kind of work in the same way, whether they're powders, they're mats, they're sponges, or foams. Most of the time, they're going to contain gelatin, collagen, cellulose, or kaolin, and they work as a matrix, which allows the blood to clot more easily. But they tend to take time to work. They need to actually contact the blood in order to function, and they typically integrate into the clot, which means you have to leave those products in place in order for them to keep working. So, how is VETIGEL different, and what is it? A lot of people still haven't heard of it. So, VETIGEL is a gel, like the name suggests, and it's made from refined plant-based polymers. Um, it has an ability to rapidly stop and withstand high pressure bleeds just because of its viscosity. If you've ever touched it in person, it is pretty thick. You can use it wherever you can get the syringe to, which I'll show you a picture in a bit. And it can kind of change its shape to different wound geometries, and it has accessories that help reach difficult to reach places because of the gel-like nature of it. And it does stop bleeding pretty immediately and it does not integrate with the clot. So this is something that you can remove and your clot is not going to be disturbed. The polymers that are in the product stop bleeding immediately by forming a mechanical barrier at the wound site. It uses ionic cross-linking that ensures that the gel adheres to the site and doesn't integrate with the fibrin patch that your patient is going to form, which again allows the patient to create their own clot independent of the product. So I have a couple pictures here in case you haven't seen this product before. It does come in a syringe like this. It comes in a sterile syringe, so it is something that you can use in surgery. It also comes with precision accessories, which can be utilized to reach hard to reach places, such as in dentals. And there's a lot of different ways you can use the product. So really, it's useful in any procedure that involves bleeding. I will say it's mostly helpful in cases where ligation and or clot rate are not reasonable or ineffective. This is not something that I use to, say, for example, replace the ligation of a major artery, but I do use it to address lots of smaller bleeds within surgery. It can work for arterial bleeds, but I sleep better at night if I have a ligature on there. I use it a lot in my pediatric and geriatric patients where I'm even more concerned about bleeding than I am in some of my other patients. I do use it in exotics. We have guinea pigs and rabbits and rats and mice and some small birds that stay here at our shelter that I do procedures on. And I really like it because there's not a setup or preparation, so it's useful in emergency or trauma types of situations. Before you use this product, it is really important to keep in mind that there is a learning curve with it. So I always recommend when you purchase this product, figuring out how it works first. The most common complaints I hear is when people buy it, they throw it on the shelf, they don't bother to learn it, something is bleeding profusely everywhere, and they just squirt a whole syringe on it and they're like, it didn't work. Well, like anything else, it's a tool that has to be used properly. So there is a learning curve. You have to understand how it works in order for it to work effectively. It is only a hemostatic agent. It's not an antibiotic. It's not pain control. It's not going to help with, say, regrowth of tissue. So if you have things like infection, you can use it in the presence of infection, but you do need to still treat the infection. It's going to give you great hemostasis, but that's all that it's meant for. It is really easy to stock on the shelf because it's temperature stable and has a good shelf life. And again, this is something that's always important to have on hand. It's one of those things that, unless you're like me and you do a ton of surgery, maybe you're not going to use it on a daily basis, but you don't want to reach for it and have it not there. So I always tell people something to keep in the back of your mind. It's not something that you can just order as needed. You should always have it on hand. I learn best with case-based learning and examples. So I'm going to go through some different cases in which I use this product. I'll share some of my favorite patients from over the years with you, talk about how I use it and some thoughts about each of those cases. So one of the first things I started using this product in is enucleations. Working in a shelter, I see lots of kittens this time of year, and unfortunately a lot of them have wonky eyes that ultimately may need to come out. But we do enucleations on other patients too. So when you're doing an enucleation, if you've ever done one before, you know that these do tend to be high bleeding procedures, both from the tissue within the orbit and then the vessels associated with the optic nerve. However, when you're dealing with vessels inside the orbit, you have to be really careful not to pull on the optic nerve because that can blind your contralateral remaining eye. And so if you're going to try to ligate those, you have to be really careful not to cause damage. So my personal preference is not to ligate those vessels. I really like using VETIGEL in these cases because it stops that bleeding really quickly. And then I don't have to worry about blinding that other eye. Um, so this is a picture from a litter of kittens, my favorite of which was Apple Pirate, who came to us with ruptured eyeball. So Apple Pirate's litter of kittens came to us when they were about 4 weeks old. Apple Pirate was a female. The entire litter was underweight. They all had severe upper respiratory symptoms. They're all dehydrated, having diarrhea. I would say 90% of the litter had eyes that were less than healthy. But the kittens were all willing to eat. They were quiet, resting comfortably, and Apple Pirate had a ruptured globe. When people ask me about working with kittens these youngs, a lot of times they will say, well, gosh, how do you know when it's time to go to surgery with these? That looks really painful. And the answer to that is different for every patient. So whenever I see one of these, I do initial stabilization. So for these guys, that meant nutritional support, antibiotics for the infection, I can't talk today. Sorry, guys. Antiparasitics because they unfortunately had a pretty heavy intestinal parasite load. We gave medication and lubrication for the eye, fluid therapy to help correct the dehydration. But then, since these kittens were willing to eat, they were resting comfortably, we decided to not risk the anesthesia this young and proceed with careful monitoring and hold off on that decision to pursue surgery until the patient was bigger and at a slightly better size, or if their clinical picture changed. So these guys had every 12-hour rechecks to see how they were doing. They were also taken care of by our medical staff. So everybody needed to let us know, the vet staff know, if there were any sort of changes in their status. So about a week later, these guys were still eating well. They were gaining weight reliably, but they started to show us that they were kind of uncomfortable. They were vocalizing more. It seemed like they were more aware of the discomfort they were experiencing. At that age, you can't really use NSAIDs because their kidneys aren't fully developed, so we're a little bit limited. We're able to use opioids and that sort of thing to help with some pain management, but again, you have to be careful of the dosing. Their upper respiratory signs had improved significantly and their diarrhea had resolved. So for this kitten in particular that had the ruptured globe, we decided to go to surgery. Just like with any patient, you want to watch them really carefully. But in these teeny weeny little guys, Apple Pirate was only 5 weeks when we had to do this surgery. Always want to have full IV access and intubation. I know they're teeny tiny, but I promise your technicians can do it. Heat support is really important for these guys, but you have to watch them really carefully because they can get hyperthermia. They're just not great at regulating their own body temperature. So you want to be careful not getting hypothermic, but also not hyperthermic. So I always have a temperature probe on these guys and I double check that temperature probe with a rectal temperature throughout the procedure. You can still use local blocks in these itty bitty little ones, but you want to be really careful about your dosing in a kitten. They're not the best at regulating their blood glucose, so we do blood glucose monitoring throughout the surgery. And then for the surgery itself, just like with any enucleation, you want to get in there, you want to stick close to the globe, avoid excessive tension, and then that's where the VETIGEL comes in to help control of the bleeding. So Apple Pirate did really, really great. This is actually Apple Pirate. She was adopted by one of my technicians. I had pictures of her litter mates earlier, but this was her about a year afterwards, doing great in her new home. So as far as specifics for if you're going to use VETIGEL in enucleations, anytime you use this product, you want to prime the syringe first. So you need to dispense a little bit of the product out of the tip so that it's coming out. That way it's ready to go. You're going to go forward with your enucleation just like you would for any other procedure. Once the globe is out, you want to take a sterile gauze, wipe it in the orbit to wipe away any excess blood. Then you're going to put your syringe all the way into the orbit and start dispensing the product and slowly back the syringe out. Once the syringe is out, then you're going to kind of, I call it swedging the syringe off to the side. The reason that that's important is that VETIGEL works by creating mechanical barriers. So you need to fully cover the bleed in order to create that barrier. If you're still having some oozing or you feel like you have not gotten a good seal, you can take a sterile gauze moistened with sterile saline and then gently place it on there for some additional pressure to help you get that complete seal. I usually wait 1 to 2 minutes after I've applied it to make sure that I have good hemostasis, but again, it works really, really quickly. Once I feel good that I don't have any bleeding, this part is really important and is unique to enucleations. In most cases, you can leave the product in place. For enucleations, you need to get about at least 95% of the product out because if you leave the product in the orbit, the body is going to break it down, but it doesn't really have a way to reabsorb it. So it can create a sterile discharge from the eye, which looks gross. It causes panic in your clients, makes the patient uncomfortable. So if we get it out, we don't have to worry about it. Again, like I mentioned, VETIGEL does not integrate with the clot, so you're not going to disrupt the clot by removing the product. Then once you've got the product out, I usually will use some sterile saline to just kind of flush the orbit out, make sure there's nothing contaminated left in there, especially if I'm working with an infected eye, and then I will proceed with closure as normal. Hopefully the videos will play. It looks like they're not going to play, but you can use it, like I mentioned, in exotics. This is from a colleague who is an exotic specialist, and she was using it in a rabbit enucleation. Shifting gears a little bit, I do a lot of dentistry in my practice. I can't tell you how many full mouth extractions I do on a regular basis, especially in my older shelter pets. And I use VETIGEL is probably, that's dentistry is probably the number one place that I use VETIGEL. Um, it helps because extraction sites can bleed really heavily, and it's not really practical to get into an extraction site and try to provide ligation. We get tired of sitting there and holding pressure. It's not great for extending the patient's anesthesia time. The other nice thing is that if you use it to stop bleeding, if you have to go after a root tip, none of us are perfect. We've all been there. If you do dentals, sometimes you get it out, but there's a root tip left behind and you have to go after it. You can use the VETIGEL to stop the bleeding, remove the VETIGEL, and then be able to visualize that root. It's also great for removing oral masses. Sometimes you have those ones that have a really broad base. There's not a lot of extra tissue in the mouth, and so it can be hard to get closure, good hemostasis. VETIGEL is really great for that. Um, so my patient for this is Grover. Grover came to our shelter. Actually, initially, the gentleman that had Grover was requesting to euthanize him. He said he just knew that Grover was in bad shape and was experiencing a lot of pain. And he said was just in terrible shape. And he wanted better for his sweet boy, and he wanted him to be at peace. And so my staff brought him to me, and he just had this little sparkle in his eye, and I felt like if we could get Grover feeling better, he might have a better life ahead. And so the gentleman graciously agreed to surrender him to our care so that he could get what he needed. So on his initial exam, poor sweet Grover had a body condition score of 2 out of 9. He had a severe flea infestation. He was anemic. He had a heart murmur. But his chest radiographs were really unremarkable. He had severe dental disease, and he is one of the few dogs in my time that I've seen that truly will not eat because of their dental disease. Normally dogs will eat no matter what, but he would see food, he would get so excited, but then he just couldn't do it. Um, the gentleman who brought him to us thought Grover was maybe 10 to 12 years old, but he was Grover's fourth home, so no one was really sure. So we ended up deciding that we were going to stabilize Grover a little bit, and then we were going to do a comprehensive oral health assessment and treatment for him. He did need full mouth extractions. We always do complete full mouth radiographs pre-extraction, and then anything we extract, you get post-extraction radiographs. In my practice, that's not optional. It's built into the cost. Even for my low-cost clients, it's not an option to decline it. That is a hill that I will die on, because I think we see so much more disease on radiographs, and then of course important to confirm that we have gotten everything. Especially, in any dental, but especially in these geriatric, maybe not the most stable patients, you want to keep your anesthesia as low as possible. So we utilize local blocks for that. Fluid therapy in our geriatric patients is kind of a topic all on its own. So suffice it to say that we're watching his pressure, all of his vitals, and his perfusion really, really closely. Excellent hemostasis is extremely important in these guys, as well as heat support, and then watching your timing and the patient. It's always okay to say that you need to stage a procedure when it comes to dentistry. I always have a conversation with clients ahead of a procedure that my goal is to get your animal off the table alive and well. I'm going to watch them very closely. If at any point we're seeing changes in our vitals that I can no longer make accommodations for and keep them safe, I'm going to wake them up whether they have finished the procedure or not. And if you aren't comfortable, full mouth extractions and dentistry in general makes a lot of people nervous. Totally okay to refer to a veterinary dentist. That's why they're there. But in our case, we went ahead and took care of Grover ourselves. That is poor Grover's mouth. You can imagine why he was not eating so well and he really was not having a great time. I will see if this video would play, but I think none of my videos no, unfortunately, my videos are not going to want to cooperate today. So when you're doing dental procedures and you're using the VETIGEL in them, as you can see kind of in the edge of this video, there's a precision accessory that I've referenced before. The precision accessory is great for getting down into the bottom of your extraction sites. What you want to do is you want to fill the entire extraction site with VETIGEL, starting at the bottom, working your way up. That's going to help you create that seal. You can leave VETIGEL in your extraction sites. That's typically what I do unless I have to go after a root. One of the number one questions I get about these is, but isn't the blood clot important for healing and the laying of new bone? Yes, absolutely it is. VETIGEL is not going to stop the formation of a blood clot. You're still going to get a blood clot. I've been using it long enough now that I have seen patients back multiple times after using VETIGEL in their extractions, and I can tell you that they heal just as well as the ones that don't get it. So that's not a concern. Sweet Grover did absolutely amazing. Within 3 hours of recovery, he ate an entire can of EN. He was walking around. He was making happy beagle noises. In the following weeks, his anemia resolved and then his heart murmur resolved. He recovered in a wonderful foster home that actually ended up keeping him. And that's been a couple of years now. And Grover, you wouldn't recognize him. He's just happy and sweet and wonderfully loved. Like I mentioned, oral mass removals and/or gingival hyperplasia cases is another great way to utilize VETIGEL. If you're going to use it in those cases, just like I mentioned before, you always want to prime the syringe. If you have like a really small mass that has a small base, you may want to use that precision accessory. But if you have something with a larger base or you're working with a large area of gingival hyperplasia, you may want to just go ahead and use the full syringe. In these cases, you're always going to want to have a gauze moistened with sterile saline ready for use because it's really hard to get a good seal in the mouth. The tissue is kind of uneven. It's hard to get it to kind of connect onto the edges of things. When you apply the product, you always want to make sure you're working perpendicular to the blade. And so you want to identify where the blade is, go perpendicular to it, and then cover the entire area with the VETIGEL, and then use that moistened gauze, put it over the area, and apply some gentle diffuse pressure for about a minute. At that point, you can remove it so that you can make sure that there's no bleeding. You don't have to. I wouldn't really want a mouthful of VETIGEL after having oral mass removed, but you're not going to hurt anything if you leave it in. VETIGEL can also be used for mass removals in other areas of the body, whether it's dermal, subcu, intra-abdominal, wherever you might be doing surgery. It can be nice for addressing multiple bleeding vessels at once, or it can be used, for bigger bleeds as well. If you're going to use it in a mass removal, you want to make sure you have all your materials together. I find in these a sterile gauze moistened with sterile saline is again pretty helpful. I really like to use it in my mastectomies. If you have those patients that maybe have a lot of subcutaneous tissue and there's a lot of oozing, I will just kind of apply it over the whole area, put a little gentle pressure, and it takes care of all of those little bleeders at once, which is really nice. So you're going to go ahead, do your surgery as you would, remove your mass wherever you identify a bleeder. Use a gauze to wipe away any excess blood. Put that syringe perpendicular to the area of the mass removal, and it will do its job. Again, you want to make sure you cover the entire area because it does need to create a mechanical cover to it, a mechanical barrier. That's what I'm looking for, so that it can stop the bleeding for you. Typically I leave it for 1 to 2 minutes before I'll take my gauze off and evaluate for hemostasis. Once you've achieved hemostasis, you can close as normal. Again, you don't have to remove the VETIGEL, although you can because the clot is not integrated with it. And this video doesn't want to play either, but if you look at it, you'll see that's a really good arterial bleed there. Even your squirters like that, you can cover it with VETIGEL. If you have a high pressure bleed like that, I would recommend using that sterile gauze to put some pressure on it, leave it for a minute or two, and then wipe it away. Again, you can use it in the different body cavities without concern. Our next topic is amputations. I like to say I do amputations on all things big and small. I did a rat last week. I do kittens. Sometimes, unfortunately, I do big pit bulls like my buddy Hiccup that's pictured here. If you've done amputations before, they are bloody procedures, and a lot of times the anatomy is not normal, and you can run into bleeders in various ways. So I really like using VETIGEL for those. Um, the case that I picked for this, I had a kind of odd case come to us a couple of years back. They were transferred from another shelter. There were four 6-week-old kittens, and they all had traumatic injuries to to their rear limbs. Three of them were right rear limbs, one was the left rear limb. Nobody knew anything about what had happened, or if they did, they weren't telling us. They were just turned in as strays by a good Samaritan. So we're not really sure what happened there, but all of these little guys were just bleeding from their little stumps. It was very, very sad. So when we work with ones this little, like I referenced before, there's some really specific challenges that we need to think about. They don't have normal renal function typically until 8 to 10 weeks old, and their hepatic function isn't quite there until 16 to 18 weeks of age. They may or may not be able to regulate temperature. Um, and it's really important to remember that pain kills and pain sensation is present at birth. So sometimes people will tell me, well, gosh, I'm just scared to use any sort of pain management in these guys. Please don't be. Opioids are a great choice to use. Just make sure you have some naloxone on hand, and then you want to decrease your dose due to the hepatic metabolism immaturity. I usually start with about an eighth to a quarter of the published dose and then look for a response. If you ever find yourself in a case where you're working with neonates that are less than 48 hours old and you're in a situation where you think you're going to have some bleeding, you always want to give vitamin K for those guys. And then don't forget you can do blood transfusions for our little patients too. But you really, in these guys, want to make sure you're stopping any sort of hemorrhage as quickly as possible because they just can't compensate for that blood loss. So in any size patient where you're working with amputations, especially if there's trauma to the tissue or in the muscle, important to note, like I mentioned before, I don't use VETIGEL to replace ligation of the major vessels. I still ligate those, although VETIGEL can be used for arterial bleeds. Again, I like to sleep at night, and so I use my ligatures for that. But in all that traumatized tissue, if you're having to cut through muscle, if you're getting lots of oozing, it's a really fast way to address those bleeders. You want to use the same basic tips that we talked about before. But the thing that I find that people struggle with a lot in these particular things is remembering that the VETIGEL needs to be applied perpendicular. And sometimes, when your assistant is pulling the leg up, you're working at an odd angle, it can be easy to forget which way that bleed is coming from. And then the other thing is in traumatized tissue, it can be a little bit hard for the VETIGEL to grab onto the tissue to create that seal. So don't be afraid to use that trick of using that moistened sterile gauze to get a good seal over the bleed. Um, and that just kind of reiterates that again, you need a good anchor, you need good coverage to stop the bleed. So this is little Bear, whose video doesn't want to work, but he was the first one of his siblings that ended up needing to have an amputation because his leg was necrotic. I did not do a full amputation on him until he was bigger, so I did just a short amputation at the site of traumatic injury, got him bigger, and then went back and amputated the rest of the leg. But he did really, really well. Um, there he is snuggled up in his foster home afterwards with a nice full belly and being very happy. Um, all four of the kittens in that litter ended up needing kind of a smaller amputation until they got a little bit bigger. And then once they got bigger, they got full amputations, and they were kind of local celebrities on the news for a bit and were known as the tripod kittens. Happy Tail is another thing that VETIGEL can be really useful in, and I actually really love it in cases where the tissue is viable and I'm looking to potentially save the tail. If you've ever dealt with a Happy Tail case, Happy Tail is, those cases where usually it's like a really big dog and they're really excited and they're wagging their tail and they're banging on things and they're bleeding all over the owner's house. Um, the struggle with those is if you correct them surgically, it can be very hard to keep them from re-traumatizing that tail because they're still going to wag their tail. They're still going to be really happy. And I've seen cases where it's like surgery after surgery, which is no fun for anyone. So when I have cases where the tissue is viable, again, if it's necrotic, we do need to go forward with surgery, but I will use a combination of VETIGEL with bandaging to try to help with that. Um, so in these cases, it's really, VETIGEL doesn't work by itself. You have to use successful bandaging technique. Um, in order to stabilize the wound, but it helps kind of stabilize that wound, prevent excess bleeding, help it be really stable under that bandage. So you want to clip and clean the tail area really well, and then apply the VETIGEL to open areas on the wound. For these ones, I don't necessarily worry so much about getting complete coverage because the bandage is going to help with that. I just put a good amount in there. And then in my practice, when we bandage happy tail cases, we use a pool noodle to like the kids' toy that you can get at like the dollar store, that my kids are obsessed with right now because they can play in the pool with them. A pool noodle is a really cool and easy way to provide some cushioning so that if that dog is going to wag its tail against the side of the kennel or the house, it's going to protect that tail. I usually only need to use VETIGEL in the first 2 to 3 bandage changes. I don't need to use it after that. I do usually change these guys bandages out every day, at least at first, and that way I can have eyes on the healing of it. I referenced dogs having this as an issue a lot, but it happens to cats too. This was a cat that lived with us in our shelter for quite a while. He was the sweetest thing. He thought he was a lab. And when he saw people, he would just wag his tail ever so happily and bang it against the inside of his cat condo. So he had to wear a pool noodle bandage for a while in order to in order to help with that. We do a lot of spays and neuters at our practice, and we have a lot of students that rotate through our clinic. Anybody that doesn't have spays and neuters is going to get to a point where they drop a pedicle. Um, and people ask me a lot of times, is this something that you can use VETIGEL in? And the answer to that is yes. My preference for these is always to identify the bleeding vessel and ligate it. However, if you have a case where you really can't get that bleeder up, sometimes the vessel just keeps shredding and you can't get it ligated. VETIGEL is a great alternative for that. Again, it is safe to use in the abdomen and it does come packaged sterilely. So if you were to drop a pedicle, the first thing you do is not panic, and you want to utilize the biological retractor on the side that you're on. So if you're on the right side, that's going to be the descending duodenum. You're going to pull it and retract it to the left. When you do that, it's going to expose the caudal pole of the right kidney, which that's, you have to remember your anatomy. That's where your bleeder is going to be coming from. On the other side, you're going to want to take your colon and take that to the right, and that's going to expose the caudal pole of the left kidney, and that's going to expose the left ovarian pedicle. I feel like sometimes I've seen this a lot with students and even some of my doctors when we have a bleeding pedicle. We all panic and we forget what the anatomy is. If you take a deep breath, have somebody grab a textbook for you if that helps, but just remember, the ovarian pedicle is not flying around all over the abdomen. And anatomically, that's where it's supposed to live. So take a deep breath and look for your bleeder there. So if you are finding that that's where your bleeding is coming from, get good exposure to the area. If you can't get that vessel up to ligate it, use a sterile gauze or have a technician scrub in with you or a fellow vet friend scrub in with you. Get some sterile gauze, put pressure on the bleed, have your assistant get that VETIGEL syringe out in a sterile manner, get it primed, get a sterile gauze, moisten it with some saline. And then when you're ready, take the gauze off the bleed, put your VETIGEL syringe perpendicular to it. In this case, I would use an entire syringe of the product. This is not a time to try to pinch pennies or save costs. Use that whole syringe and then immediately put the moistened gauze over the area and put pressure on it. I usually do it for a solid 3 to 5 minutes in these cases because I don't want to chance it that that's going to start bleeding in the abdomen. Once you've waited a few minutes, take that gauze off, confirm hemostasis. You do not need to remove this product from the abdomen, but again, it's not integrated with the clot, and you certainly can if you would like to. I've even had cases where I've used it in exploratories or liver lobectomies where I've gone in and I've used suction afterwards, and it's not integrated with the clot, so it will still work. Splenic lacerations or mesenteric vessel lacerations. Again, this is one of those things that you do enough space or abdominal procedures, it happens to the best of us. If it happens, there's no reason to panic. Um, if you have ever hit the spleen before, you know that ligating the spleen can be tricky. Alternatively, sitting there and holding pressure on the spleen for 5 to 10 minutes doesn't really feel great. And again, we're extending the anesthetic time of your patient. Um, I've had one case with one of my doctors where they hit a mesenteric vessel on entry into the abdomen for a spay. And if that happens, if you're tying off vessels of the mesentery, it can lead to questionable viability of the mesenteric vessels. So you can use VETIGEL in both of these cases to stop your bleed. You're going to use the same principles that we talked about before. It's not any different. Prime the VETIGEL syringe, have that gauze moist with sterile saline on hand in case you need it. Use a gauze to remove the excess blood, whether you're talking about the spleen or a mesenteric vessel. Go perpendicular to the bleed, cover the entire area. If it's a splenic laceration, I would use an entire syringe of the product. If it's the mesentery, you're not going to need that much, no more than a mil or two. Put that moistened gauze over the area, gentle diffuse pressure for 1 minute, and then you can check for hemostasis. Um, in those cases, we always monitor them after. If it's one of our shelter animals, they stay with us for 72 hours afterwards to make sure that they're okay. If it happens in a publicly owned animal, we have a conversation with the owner about what's happened, recommend appropriate monitoring after. Knock on wood, we've never seen an issue from one of those after. It doesn't happen too often, but when it does, it's nice to have a plan. Along with spays, we do a lot of neuters. And if you've ever done a lot of mature tomcat neuters, you know that their scrotums love to ooze. Um, so using VETIGEL in those is a great alternative to like some people will put a clothespin or like a wrap on the scrotum. In feral cats, good luck getting that wrap or that clothespin off the scrotum. So I really, really like VETIGEL for these. I take VETIGEL, I attach my precision accessory. I just go into where I made my incision into the scrotum. I fill the whole thing with VETIGEL. This provides hemostasis. You don't need to remove the VETIGEL. So if I've got a spicy tomcat who maybe isn't thrilled to be there with me, I'll just go ahead and fill up that scrotum after my procedure so that I know if he happens to have any oozing as he wakes up and his blood pressure spikes, that it's going to be taken care of. I don't have to ask my assistant to risk their hand by trying to get a wrap off of the scrotum. Biopsies, we use it in biopsies. Again, it is okay to use VETIGEL in the presence of infection or neoplasia or trauma. Again, it's not an antibiotic, so if there is infection there, you do need to treat it, and you're going to use the same technique that we talked about for your splenic lacerations for biopsies. My last case that I want to chat about is Monty. Monty was a sweet old man owned by one of my technicians. So Monty initially came in for hematuria. He saw one of my colleagues a couple weeks before. He was acting totally normally at home. Everything looked okay. He just had some blood in his pee one day. Got labs, they looked normal. Everything looked okay on exam at that time. A couple weeks later, he started acting a little weak at home, so mom brought him back in. He ended up collapsing when she was on her way to the clinic. So I saw him that morning. He had pale gums, he had a palpable abdominal mass, he had a heart murmur that had not been there before, and he just really truly did not at all look like himself. So we went ahead and we did some imaging, we did radiographs, we did ultrasound, we found a large mass in the cranial abdomen. We did some updated lab work, which showed a regenerative anemia. We repeated a urine sample, and he was hypostenuric. He still had hematuria present, and his hepatic enzymes were all within normal limits. His kidney values were fine. His electrolytes were fine. It was just those changes on the CBC and the UA. So this was Sweet Monty's radiograph, and then, like I said, we did go ahead and do some ultrasound after this, and it turned out that he had a liver mass. We talked things over with mom, let her know that, unfortunately there wasn't a really, that could be a tough prognosis. Mom could not afford referral to our area surgeon, and so she asked that we go ahead and try to do surgery. with us. So anytime you're dealing with the liver, you're likely to have significant hemorrhage, and you should be prepared if it's a non-emergent situation, like if you were doing a liver biopsy or something like that. I would always recommend checking coagulation factors, a coagulation panel prior to the surgery. In Monty's case, he had free fluid in the abdomen on ultrasound. We knew that we needed to be ready to go. We also, in his case, decided to be prepared to do a blood transfusion because he had the combination weakness. He had a drop in PCV. It dropped throughout the day while we were doing his imaging, just his general clinical appearance. And so we're lucky where I am. We have all of our resident shelter animals that are willing and able to be blood donors. We do pretty routine screening lab work on the dogs that live with us as well as the cats. So we know their health status. They all get 40X testing. So we know if they have heartworm disease or tick-borne diseases. And most of our longer term residents are happy to be blood donors if they get some sort of special treat after. So we identified a blood donor. Somebody ran to McDonald's to get him some chicken McNuggets to thank him for his donation. And we got ready to do the procedure. So the way that we used VETIGEL in this case, Monty needed to have an entire liver lobe resected, or most of a lobe, I should say. And so we resected that part of the lobe, and I used, I want to say it was 3 syringes of VETIGEL across that entire lobe. I had to make sure that I was getting perpendicular application to the bleeding site, again, because it needs that to create that barrier. Um, Again, no need to remove from the abdomen. And in Monty's case, he had several repeat abdominal ultrasounds in the days, weeks, and months following, just because, mom worked for us and she wanted to see how things were healing. And I can tell you from imaging him repeatedly that he never had any kind of granuloma formation or anything like that in response to the VETIGEL being left in his abdomen. Monty ended up doing that was him on the recovery bed after surgery. Monty ended up doing really, really well for many months after. Unfortunately, it was a carcinoma. It did end up spreading about 6 or 7 months later. But up until that point where it did spread, Monty was able to go back to chasing the other resident cats in his house, much to their dismay, and being a really happy boy. And again, throughout the whole rest of his life, he had repeat abdominal ultrasounds, and we did not see any issues from applying that VETIGEL in the abdomen. So that's what I have for everybody today. I would be happy to answer any questions about the product. If you have questions about how it works or different applications of it, I'm happy to answer those.